Hi friends, this is Parvati from KAPS. Thanks to watch my channel. I need your support, so please subscribe, share and like my channel. And also you can mention your valuable comments in the comment box, okay? And one more thing I want to share with you. If you are preparing any exam, not only the KAPS, any other exam related to pharmacy, you can refer my channel because in all exam, the basic theory is absolutely same. Whatever we study in the B Pharm, the same one we want to follow it in all exam. So I had experience with hard and KAPS. On the basis of that experience, I realized one thing. The main differentiating factor is the syllabus. So as per the syllabus we want to follow it. That is the only one thing. Okay, if you are preparing any exam, KAPS also you can refer it. That will helpful for you. And today we can start our next topic. Today we are discussing here tablet. And one more other thing, in the end of the last slide, I mentioned one screenshot that is regarding the Manan calculation, because I tried to share the link, but unfortunately it's not possible. So that's why I mentioned like that. I already confirm it in the Google. You can mention as per the topic whatever I mentioned in the screenshot. The same way you can check in the Google, you can find the Manan calculations. Manan calculations, so many different types are there. The basic calculation, allegation method, pH related questions, so many questions is there. As per the syllabus you can follow it, the calculations whatever I mentioned. The same method of other calculation is there, so you can check it there one. So that's why I mentioned like that. And okay, we can start our next topic, tablet. Start our new topic. Today we are discussing here the second dosage form, tablet. So tablet, mainly the important portion is the excipient. That is the important topic. We can expect so many questions regarding that. How much they will ask, we don't know about that, but mainly based on the excipients questions we can expect in the KAPS exam. Okay. And the first slide I mentioned here, the tablet symbol definition. Everybody knew that tablets are the solid dosage form. Mainly the manufacturing methods used for the tablet is dry granulation, wet granulation and direct compression. Detailed explanation, we don't want to study it. If you want more details about that, you can check the textbook here, CPR. I use that one. I mentioned the link also here. You can refer it. And the excipients, more examples also you can check in the page number 53. I mentioned the link here. You can follow it, that one. Okay. And the first excipient we are discussing here, the diluents. Diluents or the fillers. The main function is for the diluents is increase the weight or volume of the tablet. Functions are also important. Functions and the examples are mainly important in this topic, so you want to thorough with that. Okay, some of the examples I mentioned here. Apart from this one, you can check in the link. More examples you can find out from there. Okay. And one of the important point we want to know about it, we know the tetracyclines have drug interactions with the calcium salts. So the calcium salts cannot be used as fillers for tetracycline products. Okay. The second excipient, it's coming binders and adhesives. The function is binders help agglomerate the powder into granules during tablet compression. Okay. Mainly they are added in either dry or liquid form to promote granulation. So main function is to promote the granulation and promote cohesive compacts during direct compression. Okay. Examples are mentioned here. You can check it, that one. And one more important point we want to check it here. Acacia and gelatin have also used as binders and adhesives, and they have one more other property, that is surface active agent. One of the important point. Okay. And the next one, it's coming, the third one, disintegrants. Disintegrants mainly added to tablet formulations to facilitate disintegration when the tablet contacts water in the gastrointestinal tract. Okay. The disintegrants function by drawing water into tablet, then it becomes swelling and causing the tablet into burst out. Okay. The examples I mentioned here, examples you want to thorough with that, don't forget to check it. Okay. That link also you can check it. You can find it more examples. Okay. Then the other one, it's coming. lubricants, anti-adherents and glidants. Lubricants mainly used for to reduce the friction that occurs between the walls of the tablet and the walls of the dye cavity when the tablet is ejected. Mainly used talc, magnesium stearate and calcium stearate. Commonly used lubricants are that one. Anti-adherence is the other one. That is also the function is reduce sticking or adhesion of the tablet granulation. Glidance property everybody know. It's make it increase the flow of the tablet granulation or by reducing the friction among particles. Main examples I mentioned here, you can go through with that, okay. The other one is colors and dyes, flavoring agents, not that much important also, but we want to know about the whole one, so that's why I mentioned. Next one, it's coming adsorbents. Adsorbents mainly examples I mentioned here, and it hold the quantities of fluid in an apparently dry state. That is the adsorbents property. And the eighth one, it's coming artificial sweeteners. It's mainly for using for the flavoring purpose. Okay, some sweeteners I mentioned here. One of the important sweetener in this one, saccharin, aspartame and the mannitol also. Some important points we want to know about that. Main important point is patients with phenylketonuria. Some contraindication is there because the aspartame have the contraindication, okay, because the aspartame metabolism, it's converted to phenylalanine, so that is it's contraindicated with the fetal phenylketonuria patients, okay. And the other one of the important point is mannitol. Mannitol is sweetener that is widely employed in chewable tablets. The reason is it's not as sweet as sucrose. It leaves a cool taste in the mouth and is not hygroscopic also. That's why mannitol is used as sweetener for the chewable tablets. Okay. The next topic, it's coming the tablet types and classes. Not that much important topic, but we want to know about the whole types of tablets. So that's why I mentioned here just for the reference purpose. And some tablet types are very very important that I mentioned here. Whatever the important topics we want to concentrate, that is also I highlighted here. You can go through with that one. The first one, it's coming delayed action and enteric order tablets. We know the delayed tablets are delay the release of a drug from a dosage form. Tablets are coated and remain intact in the stomach but yield their ingredients in the intestine. Apart from the stomach, they help to release the ingredients in the intestine. That is the main important point. Okay, some examples I mentioned here. One of the important example is potassium chloride, that is enteric coated. Mainly why the reason, it's based on that one we can expect the question. The reason and explanation I mentioned here. Also one of other important point is enteric coated tablets should not be taken within 1 hour of ingestion of milk or antacids. That is mainly to avoid the premature dissolution of the coat. These 2 points based questions we can expect in the KAPS. Okay. The next slide it's coming is and the other one of the important point also, they are agents used to coating for these tablets. Fats, fatty acids, waxes, shellac and cellulose acetate phthalate. These are the mainly used coating materials for to using enteric coated tablets. Okay. The next tablets, it's coming sugar coated and chocolate coated tablets. The process of coating is important. Seal coating, subcoating and syrup coating. Mainly the functions you can check it. Seal coating, it provides the waterproofing. Subcoating, it provides mainly water insoluble shellac is using for the subcoating, and syrup coating is mainly used for the smoothing and coloring. And disadvantages I mentioned for the sugar coated. We know the in the sugar coated so many coating process are coming, so the weight is more larger than compared with the other one. Okay, that is the main disadvantage of this one. Okay, the next slide, it's coming film coated tablets. Film coated tablets is coated with a thin layer of water insoluble or water soluble polymer. Examples are very important. Thorough with the examples. Okay, and the other important point is alcohol solution of cellulosic polymers and chain is used for the film coated tablets. Other examples also I mentioned here. And one of the important process is Wurster process. This is mainly used for the coating purpose. It's a tablet coating technique. Okay, and column of air in which granules and powders are suspended, then spray with the coating solution, at last drying by rotation of solids and introduction of the hot air. They are using the hot air for the drying purpose. Okay, these are the important topics regarding tablets. Few more portions is coming. The tablet processing problem will continue, I will in the next video. That is the remaining only one portion from this topic. I will make it new video for that with. I will make it together with continue with that liquid also. That one I will make it later. Okay, in the next video we can expect from that topic. Okay, the next videos the next slides, it's starting from the calculations. Some of the important calculation techniques, basic calculation, and the other some different types are alligation method and the pH calculations also I mentioned here. You can go through with that. The detailed explanation I mentioned here. Okay, you can check it. Today I am just wind up my video here. Thanks for your support, and don't forget to subscribe, share and like my channel. I need your support. So please comment your valuable comments in the comment box also. Don't forget to share it, subscribe it. Anyway, today I am just wind up. Thank you.